Some things are certain on America's college campuses. For example, students will drink, and sometimes they plan on drinking a lot. And they worry about inevitably putting on weight, the so-called freshman 15, made even more likely by heavy drinking. For years, though, many students have tried to have it both ways, drinking as much as they want without the effects on their waistlines. All it takes is a little drunkorexia.
It is sort of a weight management for certain people, and it's sort of a way to feel like they can drink as much as they want to without blowing their diet.
That's Dr. Dipali Rinker, a research assistant professor at the University of Houston who has studied drunkorexia.
Drunkorexia is sort of a colloquial term, and it's not a medical term, but it's become sort of a colloquial term to describe diet-related behaviors associated with alcohol use. And typically the purpose of quote-unquote drunkorexia is to sort of either get drunk faster or, more commonly, to trade in food calories for alcohol calories. They are probably skipping a meal, restricting food, choosing not to eat certain things before then in preparation for going out and drinking a certain amount. It could be that extensive. It could be as simple as not eating after maybe 6 or 7 o'clock in the evening if you know you're planning to go out later that evening. Or it could be skipping an entire day worth of meals.
You don't eat enough, so you essentially drink on an empty stomach.
Joy Stevenson-Laws is founder of the nonprofit Proactive Health Labs.
The combination of alcohol consumption with poor food intake. And when you do that, you run the risk of getting very drunk and very unhealthy.
When you just get all your calories through alcohol and you don't eat much regular food, then you end up with problems not having enough vitamins in your system, not having enough essential amino acids, things that our body needs in order to build muscle, in order to build bones, in order to maintain our blood and our iron at the significant levels. So you are getting malnourished.
That's Dr. Petros Livonis, professor and chairman of psychiatry at the Rutgers, New Jersey Medical School.
You don't see it. You are tricked into thinking that you are okay because you get enough calories from alcohol, but essentially your body is going into a state of malnutrition because you don't get the essential building blocks that are provided through food.
This is an example of a kind of behavior where maybe you think you're doing something good for your body. Maybe you think you're being healthy because you're trying to keep your calories down or you're exercising, but in some way it's backfiring. It's leading you to engage in another kind of high-risk behavior.
Not much research has been done on drunkorexia. Most studies have found that college women are most prone to engage in drunkorexic activity. But one British study shows that women in their 30s and 40s are participants as well. Rinker's research shows that college men are far from immune.
That was a little bit surprising because the little research that does exist seems to suggest that women are more likely to engage in these behaviors. And that is instinctively what we would think. We would think that women are more weight conscious and more likely to engage in these behaviors. And we didn't really find much in the way of gender differences. We really saw that men were just as likely to engage in these kinds of behaviors as women.
However, Rinker's study shows that drunkorexia on campus is alarmingly common. Among college students who drink at all, about 80% had engaged in some kind of drunkorexia activity in the preceding 3 months. Simply skipping dinner every now and then doesn't concern Livonis, but day in and day out, that does concern him. And he thinks that perhaps 5% of college students fall into that category. And it brings lots of health risks.
There are quite a lot of physical effects, mostly having to do with the gastrointestinal system, liver, the esophagus, the stomach. So people may end up with significant problems further down the line in terms of liver failure, heart. You may have heart conditions like heart failure resulting directly from overuse of alcohol.
And Livonis says if someone relies on cutting out food to make room for drink for very long, they usually find it defeats the purpose.
alcohol does have a lot of calories itself. You think that you have tricked your body into slimming down, and at the earlier stages of this practice, you may be, in fact, successful, but further down the line, you are going to gain weight.
One reason is that, according to Rinker's study, drunkorexia behavior leads to more drinking and more problems related to it.
The more frequently you engaged in drunkorexic type behaviors, whatever they are or whatever the combination might be, you are more likely to drink more heavily and you are more likely to drink more problematically. So all the way from, hangovers, headaches, nausea, to things like skipping classes, not completing assignments, all the way to blacking out.
Given all that, it might be tempting to think of drunkorexia as mostly an alcohol problem. But as the name implies, it can be an eating disorder as well. The two can feed into each other.
If you are already engaging in disordered kinds of eating, and this can range all the way from preoccupation with looks and concern about gaining weight, and I'm talking about over concern because most of us have that concern to some extent, all the way to a full-blown diagnosis of anorexia or bulimia. We do know that those individuals are more likely to engage in these kinds of behaviors. We know that if you're already a heavy drinker, you're more likely to engage in these kinds of behaviors, which of course makes sense. In general, if you're more likely to engage in one kind of risky behavior, you're more likely to engage in another kind of risky behavior.
Rinker says if somebody's already a heavy drinker, maybe they're one of those people who can drink a lot and not really feel it. Maybe they enjoy being able to hold their liquor. But Lavonis says that creates another risk.
A lot of young people feel that if they have high tolerance to alcohol, if they can drink everybody under the table, then somehow they're stronger and they can be at lower risk of alcoholism. And in fact, they have it very wrong. It's exactly the opposite. People on a genetic basis who have high tolerance to alcohol are at the highest risk of becoming alcoholics themselves.
But how do you stop that? Stevenson Law says colleges aren't trying to stop drinking, but reduce it with a harm reduction mindset.
They know that drinking is going to occur, especially among that age group. So they have taken steps to be more responsible in informing the students. I don't know what else they could be expected to do in connection with working with the parents to make sure that we as parents educate our kids to be aware of how to drink responsibly, because you can't take the approach that the kids are never going to drink. It's going to happen. So we have to accept that fact and perhaps be more aware and teach them how to drink responsibly.
For example, colleges are trying to promote the message that moderate drinking is more fun than getting totally wasted. William Mupo is the former health promotions coordinator for the University of Texas at Austin.
A lot of the positive perceptions that people get out of drinking, so think of being more relaxed or more extroverted, loosening up, having a good time, even feeling sometimes a little bit more energetic via the buzz, those effects come at a blood alcohol concentration typically around 0.05. So that's a lot less than the standard myth of, well, if some alcohol is making me feel great, then if I have a few more shots, then I'm going to feel amazing. So one of the strategies is kind of cutting off that feeling that you need to do this compensatory behavior by making sure that students are moderating their alcohol drink. They're alternating alcoholic and non-alcoholic drinks, that they're setting a drink limit.
Mupo says the university also promotes that students have something to eat while they're drinking to slow down the absorption of alcohol. They make it as actionable as possible.
It's one thing to say, well, go ahead and eat before you drink or drink, but it's helpful to let people know actually the types of foods that are going to slow down that absorption of alcohol, which tends to be healthy fats and proteins.
So why do students drink? Why do they avoid food before going to a party? They feel there's good reason to get more bang out of every ounce. But Rinker says studies have found one more big reason, and a person may not be consciously aware of its influence.
Probably the biggest predictor of heavy drinking among college students is the normative perception, or the perception that everybody is doing this and that this is the norm. We found that consistently in this study that perceiving that everybody else, that the typical college student of the same sex is engaging in this behavior leads to greater likelihood of actually engaging in these behaviors.
Social pressure can be strong. If you think everybody's drunkorexic, you may think you have to do it too just to fit in. But everybody doesn't drink on campus. It's a message many campuses are trying to spread.
We sort of talk to the students about, this is how much you think people are drinking or engaging in drunkorexic behaviors. This is actually how much people are engaging in these drunkorexic behaviors. And usually, I'd say almost all of the time, students overestimate how much people are drinking, how frequently people are drinking, and in this case, how frequently people were engaging in drunkorexic behaviors. And the reality is that they aren't as engaging in as much of it as they think they are. And a lot of times that discrepancy is quite wide. And we do see that when we provide them with this kind of feedback about their perceptions and the reality, that we do see reductions in drinking, or especially in, heavy episodic or problem drinking.
You can find more information about all of our guests on our website, radiohealthjournal.org. This segment originally aired March 2018. Our lead producer is Kristen Farah. I'm Reed Pence. This segment was brought to you by the U.S. Department of Health and Human Services. Updated COVID vaccines have arrived just in time for the season that brings us all together. Find updated COVID vaccines at vaccines.gov. We can do this. Coming up next week on Radio Health Journal.
I mean, who knows what amazing minds we've lost to coal mines and these kind of places where access and resources kept great opportunity from being developed within individuals.
A new policy that will help create equal access of knowledge.
Then, is COVID the new flu?
That's the goal. We live with it perhaps seasonally, but we cannot let our foot off the gas, and we have definitely gone too far in the other direction.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
They're on a very fixed light-dark cycle, even in space, even though they're going around the Earth every 90 minutes, and so their day-night cycle is a 90-minute cycle.
The ways in which astronauts sleep in space. Then,
it's indescribable what a person goes through as an innocent man being charged with very, very serious crimes.
Every year, innocent people in the U.S. are convicted of serious crimes they didn't commit and sentenced to years in prison. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.